This video is a walkthrough of what would happen step by step when a patient comes in for liposuction. The patient will come to our clinic, they will fill out some registration forms, we will then bring them to the room. At that time, we will have them change in a gown, and myself and the patient will go over the concerned areas. I will at that time mark the areas and show them to the patient so me and the patient are on the same page. After that, we will have the patient lay down. We do give antibiotics by mouth, so patient will take his or her antibiotics. We will check the blood pressure, and I will take a small needle and I will put some lidocaine on. For example, we're talking about the belly today, so I'll put a little bit of lidocaine here, and then using that numbed area, I'm going to put fluid in the belly. That is a mixture of lidocaine, epinephrine, bicarb, and saline. It was first brought to public knowledge by Dr. Jeffrey Klein, and that is the guy who did the studies to bring this out to the clinics, and he trained me. And we will put that fluid in the area where we want to treat the patient. And after that, we will give the patient about 45 minutes. In that time, the patient can have some snacks, can go to the bathroom. Again, there is no rush in liposuction. We don't rush our liposuction patients at all. We want them to be comfortable. When 45 minutes have passed, I will come back and we will go ahead and clean the belly again. And then I will use a 2mm adit, which is just like a punch biopsy. And then I'm going to use that, and I'm going to put a cannula inside the area where I want to remove the fat from. Again, remembering that there is skin, there is fat, and then there is muscle. And below the muscle are all the viscera, like the liver, etc. And we are only in the place which is between the skin and the muscle, because that is the place we have numbed. I'm gonna suck the fat out of there. It can take anywhere from 90 minutes to 3 hours, depending on how big a case it is. And after we are done, we will let the patient rest for about 30 minutes to 45 minutes. The patient at that time can go to the bathroom, eat something else if they're hungry, drink some water. And after that, we will put bandages and ABD pads, which are fancy word for really absorbable pads. And then all the leakage of fluid that will happen afterwards is absorbed by the bandages. And then we will also wear a compression on top, and patient will go home. This is like what a liposuction experience is when you come to Afzal clinics. We want to make sure that you are well informed on what we are going to do. We also want to make sure that you feel comfortable with the information you have. And when you are here, you feel like you are cared for. And when you go home, you can contact us if you have a question. That is essentially what everything we do revolves around. We want you to be empowered by the information. We want you to be comfortable so we can do the right treatment for you. We want to make sure that we're available for you if you have any questions.